Hello everyone, and welcome to this audio podcast as part of this Pathology edition. This audio podcast is part of the Type 4 squad, and this audio podcast is part of the Ty4Phoon Twixzter, this audio podcast as part of another Storm Robotics production. This audio podcast will have an overview in around the results and the themes derived in as part of this peer in part of and as part of peer-reviewed works from 2020 and looking at peer-reviewed works where there was a systematic review and looking at works peer-reviewed works in around healthcare scientists and primary care, and looking at this from a basis in concept in and around peer reviews in around a peer review works and aligned to a systematic review. So in around around the basis of the themes, the results and the themes derived, there were five main themes. In this works from this works, and in around the results from the systematic review and in around the systematic review. So five themes derived from this included health, number one, healthcare science and leadership. Number two, looking at collaborations. Number three, theme three, looking at primary care and education, and number four, looking at skill mix, and theme five, in around barriers to integration. The peer review works has a summary in around an overview in around the literature. In theme one, and healthcare science, and looking at healthcare science and leadership. So owing to sort of the perception of scientists as allied health professionals, or AHPs, as AHPs, the perception or a part of the perception is that the AHPs have in the main stayed sort of behind in and around specialties around different divisions of healthcare, but also where these health where owing to the perception of these AHPs, scientists are perhaps required to integrate highlighting focuses in around disease etiology, pathology, so health and and aspects around healthcare practices or health practices surrounding specific health issue, surrounding in and around specific disease modalities, uh, uh, and aligned to where these AHPs provide are those AHPs that would normally carry out sort of laboratory the sort of laboratory tests and investigations, blood and in around blood and also around aspects aligned to organs as well. And so at the same time, healthcare scientists or scientists who are involved in aspects of laboratory medicine, as well as in around aspects of laboratory medicine, pathology, and also in around highlighting the issues in around different aspects of disease, through for example, sort of published works through published works through published works. At the same time, the science that transpires through is often misinformed or misplaced, and generally literature informs that scientists and that generally scientists as AHPs um, uh, as AHPs, and also where there is a desire to reach beyond the confines of laboratory practices, and to make healthcare more effective. Research informs that scientists are required who can communicate with decision makers in context of society, irrespective of area of scientific specialty. And one of the broader responsibilities of such AHPs is to provide the public with sort of a knowledge base or understanding, and where healthcare scientists, sort of leaders in context of leadership, also should be encouraged, where such AHPs have more dialogue with multidisciplinary colleagues, and for example, when highlighting, highlighting when it is safe, when it is typically safe to transfuse patients, for example, who may require transfuse patients who may have, for example, renal insufficiency, who may require who may so when it is safe to transfuse patients, or transfuse patients who may have renal insufficiency, but at the same time, where service users or patients have a loss of blood, loss of blood, and where symptomology is linked to is aligned to anemia or anemia symptomology. At the same time, leadership also relates or is in regards to understanding or where patients where patients or service users have advantage, may have advantage with alternative care or treatment pathways, and there is a requirement for sort of examples. There is a requirement for examples such that can be translated across different areas of healthcare practices, and there is perhaps an obvious a role or basis for such AHPs, for example, to link, for example, standard operating procedures, or SOPs, standard operating procedures, to evidence-based practices. Um, and at the same time, evidence also indicates that primary care teams can have ongoing issues in regards to the basis of particular chronic diseases, or chronic disease models, in context of long-term conditions, despite access to frameworks and guidelines. And at present, primary care or primary care teams may not have sort of the skill set mix to provide, for example, to provide the sort of educational basis, or surrounding particular diseases, owing to sort of the owing to disease and etiology intricacies. And it is important that service users or patients are provided with constancy in context of healthcare. Health literacy is also a sort of a main element, since more service users and patients are prompted or propagated to become are propagated to be more empowered, and the healthcare scientist, in context of the healthcare scientist or healthcare scientist a role, in context of the healthcare scientist and the healthcare scientists basis, the role in around the works and in around the works um, uh, could be and should be should be sort of expanded into understanding, sort of into where understanding can be prompted in around aspects of healthcare and aspects of healthcare policy, in aspects of healthcare policy, and leadership from healthcare scientists in context of particular diseases, or particular diseases or etiologies at present or currently do not exist in aligned to primary care. Laboratory test parameters and investigations for particular diseases are validated or verified by by scientists in context of pathology as part of routine investigations, and particularly in context of particular laboratory investigations. And at the same time, service users are also becoming service users and patients are becoming more have become have been propagated to become more informed, owing to access to laboratory data, and if and at the same time, if electronic systems are integrated, then this could improve areas aspects of leadership as well. Community-based at the same time, in line with this, community-based screening programs also have the advantage of increasing a sense of awareness and population level. And this was also where scientists, healthcare scientists, could be involved to improve across several disease etiologies, and involvement again at primary care level could thus enhance joined up sort of thinking in the care of service users and those with particular with sort of with a particular diseases, and especially highlighting the sort of education on the pertinence in around and around investigations in around investigations. And one national study seeks to provide the understanding of factors that and processes that lead, for example, scientists to interact in context of public communication, in context of public communication, and healthcare scientists who frequently review sort of journals, healthcare frameworks and guidelines, and routinely see comparatively high representation in issue in important in issues in around the public domain and in and across health and disease are is where future understanding is where future or prospective understanding and where such health professionals can and should be prompting understanding of specific in around particular diseases, and also in around particular areas of sort of disease pathologies. And owing to an increase in prevalences of particular primary diseases, there is a higher there are risk factors that have an impact on there are risk factors that have impact on disease, including socioeconomic status, socioeconomic status, and being one of the main aspects. And the rationale for having in this peer review works as part of this theme one. There is that perhaps it has also been documented that perhaps there needs to be more integrated perspectives in around this important element. And in a report highlighting the modelization of pathology in laboratory medicine in the UK, it is has has been documented that the main sort of drivers for change to pathology and laboratory medicine in service include, for example, greater need for patient-focused services, the need to embrace competitiveness and plurality and provision, a requirement to reprofile the workforce to make it better suited to sort of modern ways of working, The need for definition of core data to develop a framework in around efficiency and effectiveness, recognition of status of core clinical services in regard to an impact on particular disease in around particular diseases and leading to requirement for laboratory services to be commissioned and delivered as part of integrated healthcare systems, and also a need for leadership leadership in around where research has highlighted that where research has highlighted that there is a need for or requirement for this sort of division of the workforce, this division of the workforce, to demonstrate a sense of leadership, sort of more generally, in around theme two and collaborations, or collaborative working. Um, there is that has been peer reviewed works. There is a traditional sense that scientists have always been involved in the support of healthcare teams, providing test results and validations in around pathology, and as part of and in between healthcare sectors. Understanding sort of aspects of economics and smarter working initiatives would also streamline care for those for those with a particular for those in for service users for service users in around particular specific where specific disease modalities are linked are important to are important as well. And at present, however, the evidence base for collaborative working and where these particular AHPs are physically involved is insubstantial. And these AHPs are not traditionally, for example, patient-facing healthcare professionals. Healthcare sciences as a hidden service remains unchanged, and cross-professional collaborative working is or can be questionable. And for example, web pages, for example, lab tests online provide service users and patients with information on what tests are for, and what they and why they are being requested from healthcare service providers. The climate at the same time is right is is also important is important to it's important so that so that there is a sort of a propagation to prompt to encourage a sense of collaborations between healthcare professionals, to prompt collaborations between different healthcare professionals, and between different healthcare sectors, and owing to sort of tech and the around tech and aspects of POCT, or point of care testing, or NPT, or near patient testing, this could prompt healthcare scientists to become more proactive in advancing to monitor suspect or high risk service users in around particular conditions, or particular conditions, and to be involved in for example, quality assurance of particular test requests and investigations. And this can include quality assurance and monitoring specific POCT, point of care testing initiatives. So, for example, in collaboration with primary care physicians, or primary care physicians, or in collaboration with in collaboration with community or primary care pharmacists, and scientists could provide sort of explanations or basis on in around particular certain investigations, and the broad and sort of the implications of the results or investigations. And increasingly scientists can validate and interpret POCT, point of care testing results, or at least know how such investigations are quintessential in primary care. Healthcare scientists, at the same time, have a sort of a unique role to play in context of primary care. In context of primary care, and healthcare scientists, for example, again, need to be healthcare scientists are required to be able to share or prompt sort of the technical and scientific knowledge in terms that in terms that layman can understand, to help sort of bridge sort of public understanding relating to clinical scenarios, and especially to capture to link patient reported outcomes. And there is a broader there is evidence to suggest that more health promotion, for example, in primary care or community, can support the understanding of some of the complexities some of the complexities in regards to health and disease. And scientists are not scientists can also be be sort of AHPs that can again sort of link sort of the basis between sort of frontline sort of the physicians, government officials, human rights and relief workers, who are also look to sort of drive sort of changes as well. And in some in some published in some research, there have been there has has been documented that the training the needs the quality and in and around sort of the where where the scientific language and around the scientific language and the train and sort of training needs and the training needs analysis identified or in particular research identified that very little difference between there's very little difference a sort of service provision in rural versus remote health disciplines, or a rural and remote health in rural remote sort of disciplines or specialties. And it was perceived that educators, for example, in one sort of a lot of published works, that educators manage the chronic kidney disease well, manage chronic kidney disease, manage chronic disease, and yet at the same time found prevention and detection to be sort of the challenge, where the challenges are where the challenges have been. And in particular in specific literature it have been evidence that there should be more practical ways to alter the acute disease based practice model that dominates in the health workforce towards an integrated, systematic, population-based approach. And the investigation highlights that scientists as AHPs have have an important basis in this regard. In qualitative research, in some qualitative research, authors also highlighted that one of the challenges has been ensuring clear definitions of providers' roles and expectations regarding care aspects of care, and defining roles and responsibilities would enhance positive elements of collaborative and interprofessional sort of working and reducing and reduce misunderstandings regarding procedures, responsibilities, and authority. Collaborative, patient-centered, or service user centered practice is designed to promote remotely active participation of each different specialties in around service users and patient care. And collaborative working enhances patient and family centered objectives and values and at the same time where a collaborative patient-centered practice provides mechanisms for continuous for sort of a continuous continuous collaborative approach, and at the same time in a particular document in a particular documented research or documented works, there is no there has been no participation from healthcare scientists and in a meta-analysis of 72 in around just over 70 independent investigations across a range of industries, highlighted that information sharing positively predicted the performance predicted positive performance in around collaborative approaches, and there are multiple interfaces that exchange where exchange of information between members of healthcare teams is needed for safe and effective service around effective patient care. Areas where information sharing has been shown to be inadequate, where areas of information in context of service provision or healthcare service provision has been evidenced to be inadequate. Such at the same time, health professionals such as scientists, healthcare scientists, traditionally provide laboratory and diagnostic investigations. Understanding, however, to improve sort of service provision, a scientist's role or basis could be linked into primary service provisions, thus enhancing smarter and collaborative working, especially in the care of patients with in the care of patients under particular disease categories, and evidence-based knowledge would help in the formulation of particular policies, for examples, and that could optimize the laboratory service delivery in the NHS, for example, in the NHS or NHS England, and with inadequate mix of scientific staff seen in most NHS laboratories, there has been a challenge in meeting diagnostic demands without compromising quality of investigations, and so thus roles and smarter working and collaborative efforts would help reduce the challenges in meeting diagnostic demands if healthcare scientists are also involved more so in primary care from other sort of modalities of professionalism, and this would also reduce this would also increase a flow of services and reduce service strains. So now in around theme 3, and looking at primary care and some aspects around chronic kidney, looking at disease modality, and sort of education, the educational aspects. So professional integration has been highlighted in several papers several papers relating to the care of service users or patients with particular diseases, long term diseases, and where there is a gap in healthcare professional integration. Where there is a gap in healthcare and professional integration is is where scientists' involvement at face value in the care of patients for service users for service users is still has not been interrogated or evaluated. And so modern healthcare is delivered by modern healthcare is delivered by teams rather than individuals, and requires momentum of healthcare professionals from various specialties. And it is understood that failures in that professional integration and teamwork lead directly and teamwork lead directly to compromised can lead it is understood that failures in professional integration and teamwork can lead directly into compromised care and inefficiency. So professional integration is as much about smarter working as it is about professional developing best practices. And there are multiple interfaces where route of patient care between members of the healthcare team is needed for safe and effective practices. And at the same time, in a mixed methodology investigation, one team sought to examine the work of commissioning care for patients with long-term diseases, and the factors inhibiting inhibiting or or facilitating commissioners making service change. And the research suggests that at least for a long-term disease that at least for long-term disease services, decision makers need to think differently about the way in which commissioning again is carried out, and about the operation about the operation in context of the healthcare in context of healthcare market. And the investigators did not include analysis for example, of costs associated with commissioning work, but had revealed that it is an area it is that it, but the investigators had revealed it to be a basis a basis where there is where there had been where there is a requirement for further interrogation prospectively, and therein it would be advantageous to underline if there is value for money where patients or service users with long-standing conditions like long-standing diseases have access to healthcare scientists in context of primary care to support diagnoses and disease trends, especially wherein GPs or primary healthcare physicians and nurses and nurses may have incongruities regarding again particular terminologies, and in around patient in around sort of an aspect in context of the National Institute of Healthcare Research, or NIHR, and in context of PPI, or patient and public involvement on the entities entities that are required, that are also required, and collaborations are important in developing and supporting service users in context of those with in context of particular disease of specific specific and particular diseases, and so in another in respect in a retrospective cohort investigation using data from 426 primary care practices where there was a population over 2 million, in the in the United Kingdom. The age standardized prevalence of those of the of the standardized prevalences of disease around disease severity of a particular long-standing condition was identified using two consecutive calculations in around in around in around in around in around the disease and and around the disease, and where around the disease where the calculation around the disease was carried out sort of 7 days was 7 days apart, 7 days, and for service users with for patients, service users were confirmed particular long-standing condition inclusion in a practice in practice register was associated with increasing age gender and also other other sort of specific sort of etiologies. And the team who carried out this investigation, this retrospective cohort investigation, highlighted that robust estimation of prevalence of disease severity. Severity uncovers significant misclassification and subsequent suboptimal management in primary care, and in primary care as a professional integration could bridge issues where there is where there has where could bridge issues where there is sort of scientists, healthcare scientists or scientists involvement. In a commissioning report, in another commissioning report, authors informed that new models of contracting, such as accountable lead provider or alliance contracting, need interrogating to help need interrogation to help the integration of services. Healthcare scientists, where applicable would need to highlight how they can support service users and patients with from primary care perspectives, and how this would reduce for example costs, and sort of the general financial burden on the NHS, or the National Health Service. Health professionals have seen several health professionals have seen several new acronyms and lots and sort of activity and several new processes aimed at constructing or indeed reconstructing the ways in which services are in the ways as services are sort of bartered and delivered. And so PPI or patient public involvement, to help understand where healthcare service improvement enhancements are required are also important when it comes to joined up care, joined up healthcare, and PPI in on PPI on in on healthcare commissioning uh, um, is and can be important, can be important sort of in around the development and around aspects of commissioning in part in part, and the potential advantages of integrated care where healthcare scientists can be involved has not been assessed, has not been assessed. um, uh, so we're now in around theme four, and looking at sort of skill mix. So theme three had delved into some aspects of skill mix in some regard, some base from some in some regard. Theme four is thus where healthcare scientists are generally trained to generally involved in aspects of healthcare or service provision where they are where the workforce is trained to apply specific knowledge, fulfill test requests and investigations, audit, validate, and authorize investigations. And what is presently what is presently um, sort of known was important in the NHS or National Health Service laboratories is at the same time at the same time is sort of today is a systematic reprofiling of skill set mix, in which the labor in sort of in for example hospital laboratories, or in around sort of around pathology. And most laboratories are now, for example, employing more support staff, for example, laboratory assistant, for example, and or associate practitioners, in preference to qualified scientists who are trained to apply skill base across pathology, and these professionals have now been these professionals have been unfortunately sort of downsized, and this means that there are now more issues related this means that there have been more issues in regard to staff cover time, time delays, access to more qualified staff, processes being compromised, and more risk management and general culture and realignment issues. Less experienced or lower cadre laboratory support staff have been sort of have been involved to carry out tasks for which in some parts are in some parts in some parts of laboratory practices, where such staff such staff such staff are not licensed or certified, are not licensed or certified, and often and often not trained or qualified or competent to perform, or until at least where until at least until where lesser grade staff or lesser grade staff are trained and where for example the the time for example, laboratory assistant associate practitioners being involved in aspects of pathology. Pathology are involved, but at the same time, the 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 tasks are carried out are carried out where as part of the laboratory assistant and associate practitioners sort of part of their portfolio. Healthcare scientists play a role in the diagnosis of diseases such as anemia, malignancies, emergency blood transfusion services, meningitis, hepatitis, chronic liver diseases, hematological malignancies, and so as and hematological malignancies, for example. At the same time, the United Kingdom, the Department of Health and the Institute of Biomedical Sciences advocates that patient safety must always underpin the modernisation of careers in healthcare science, despite emphasis on competitiveness and cost efficiency advocated by national reviews of pathology services. The IBMS emphasizes the need a need to maintain a robust relationship between a robust association between laboratory workload and staff numbers, and given most NHS laboratories have now become more automated. Routine tasks are now undertaken by support staff and delegated to AHPs. At the same time, the knowledge and skill-based healthcare scientists acquired through become more specialized or advanced in healthcare delivery that extends beyond the core and pre-registration portfolio for a given area of practice. skill Skill set required by health workforce by the health workforce change depending on and upon needs and demands, and this includes diversification. Diversification takes place as thus and including number one, the identification of new markets and new settings for the delivery of certain services. B, the new ways of providing existing services. C, the introduction of new types of tech, for example, such as such in around tech and in around sort of new sort of therapies and sort of for the utilization of a new language to describe existing treatments, for example, and five, in sort of in around the new philosophies of care. And so healthcare scientists who have trained to acquire variable skills across practices and across specialties, and there should perhaps be opportunities to apply skill mix and apply knowledge base to support patients with for example, long-standing illnesses illnesses in primary care. And this will not, and this would bring a much required healthcare professional asset into the sector, and more use of tech integration would and more use of tech in tech in some regard. Would also can also can also be useful. At the same time, and more and more POCT, or point of care testing initiatives, have been developing owing to clinical need in both between primary and secondary care sectors, and this being the case, the skill sets required to provide an accurate and decisive POCT service, for example, requires a good level of skill set mix, and an approach that can be varied with local circumstances is to be preferential, and it is considered imperative that whatever POCT is utilized, it must be monitored and supervised by qualified staff of a clinical laboratory that is accredited. Thus to highlight on this, that any POCT service that is identified or integrated into primary care, for example, that there should be that there should be a link between the primary there should be a link between the POCT service in context of primary care and laboratory in line to the laboratory services, and it is at the same time whilst at present, non-laboratory staff are trained. Staff are trained to operate in some regions. In context of POCT, some POCT programs to bridge between diagnosis and referral of suspect and high risk patients in primary care. Specialist scientists could be involved in regarding in regarding quality assurance, and the ensuring the translation of data from practices to from practice to laboratory in a more quantified basis, in a more quantified way, and sort of greater use of skill set will be important by releasing capacity to releasing capacity of the United Kingdom healthcare. If United Kingdom healthcare is to offer patients or service users with long-standing diseases choice through services in healthcare today, the aim should be to equip service users with the tools to ensure they have a sort of a strong basis, or a basis for shared decision making at all levels of healthcare. And then, so in around theme 5 in context of in context of barriers to sort of integration. So some of the aspects here have been mentioned in part in theme 4. However, several health professional organizations sort of worldwide have have affirmed in sort of recent sort of works and literature to sort of statements to define roles and define roles and characteristics of sort of successful teams. And patients or service users are undoubtedly intrigued in aspects of self-care and must be part of the communication process too. Early involvement has also been shown to minimize errors and potential adverse events. And there is still a misconception that long-standing conditions are, for example, a part of disease processes that could occur in older age. For example, chronic kidney disease or CKD, for example, again, chronic kidney disease, and where this can induce fear and stigmatizing for service users, and patients will service users or patients will can gain benefit from one-to-one sort of consultations with healthcare scientists in around in primary care to help provide understanding of disease trends. Professional integration would also enhance access to care, with new healthcare initiatives on the horizon. Facilities could could be utilized, allowing service users to have more allowing prompting healthcare scientists as AHPs to have more involvement based on community need. Healthcare scientists, based on community need, but also based on between particular healthcare sectors. Healthcare scientists will also have to become acquainted with these to ensure services are integrated, supporting care of CKD, care of service users and patients. And it is a responsibility of it is a responsibility of scientists to provide the public with new knowledge, and this too is important in primary care. At present, healthcare scientists are not integrated into the care of service users effectively, and they are at the back of healthcare. They are at the back of healthcare, and senior staff with specific healthcare professions are confident. Senior staff with specific healthcare professions uh, are confident to provide guidelines where expertise is needed. Less senior staff may not feel they can challenge decisions, or offer suggestions or alternative diagnoses, and so may conceal concerns. Some of the strategies to overcome barriers to integration have been summarized as, for example, number one, teaching effective communication; B, train teams together; and C, train teams using simulation; D, define inclusive teams; and E, develop organization culture, or culture supporting healthcare teams. And these points should improve or at least help open the barriers to interprofessional collaboration. the barriers to interprofessional collaboration, and so this draws a close to this audio podcast, and where this audio podcast was looking into the sort of the themes the sort of the five themes derived as part of this systematic review. This peer review works from 2020, and the audio the audio podcast in following will we'll look into some of the critical analysis and sort of the critical analysis and implications for practice. So that draws this audio podcast to a close. This has been an audio podcast as part of the Pathology edition, part of the Type 4 squad, and part of the Ty4Phoon Twixzter. This has been another Storm Robotics production. Thank you.